Hi, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And good afternoon po sa lahat ng nanonood sa atin ngayon, sa ating mga kasamahan sa CRS, sa mga kasamahan po natin sa UP Mindanao, at dito po sa kasamahan natin sa mga Bangsamoro government, in particular po sa Ministry of Health. Maulan po na hapon sa ating lahat. Ito pong project na ito ay nag-come up because sa pangangailangan po natin na ma-address natin po yung mga issues sa COVID-19 pandemic na to. Unang-una po yung issue ng ating mga responses on COVID-19, particularly on the mental health aspect. So nakikita po natin na pagdating sa ating mga actions, medyo kinukulang po tayo doon sa ating responses towards the psychological effect po ng COVID-19 sa atin. At saka din po gusto din po natin na mapaganda yung ating aksyon sa pagbabakuna din. So kaya po nagkaroon tayo sa katulong po ng ating mga kaibigan sa CRS, ng Ma'am Chin. Nagkaroon po tayo ng mga idea at nagkaroon po tayo ng mga kumbaga po mga steps, mga actions na sa tingin natin ay talagang makakatulong ng malaki upang mapaganda at mapabuti especially yung ating mental health during the pandemic. At the same time, mapaganda po yung ating coverage ng ating pagbabakuna. So I hope this partnership with Catholic Relief na ay magtatagal at magtuloy-tuloy po, hindi lang po sa ngayon sa pandemya, kundi po doon po din sa ating mga regular program po na ginagawa natin dito sa Ministry of Health. So sa muli po, ako po ang inyong kapatid na ba? Si Dr. Amirel Usman, ang Director General po ng Ministry of Health of the Bangsamoro Government. Assalamualaikum warahmatullahi taala wabarakatuh.
Maraming salamat, Doc, for your inspiring welcome remarks and for giving us an overview of the partnership. And also, for now, Maria Concepcion Nobleza, the Catholic Relief Services Philippines Country Head of Programming, will give us the detailed background of the project and the activities. Allow me to share my screen. Yes, may we request Chester to allow us to share screen. Okay, for a moment. Sige po.
Okay. Yeah. Next slide, Errol, please. Magandang hapon po sa lahat. Maraming salamat po sa panahon ninyo to be with us in this very momentous occasion dahil po magkakaroon po ng partnership ang CRS at saka ang Ministry of Health. Okay. So to share briefly what this partnership is all about, next slide please, Errol. Ayan, kung gusto po natin, kinuwento din ni Dr. Usman kanina na that vulnerable households sa BARMM Philippines will be resilient to the COVID-19 surge. At para po dito, for the project to contribute to this, next slide please. Tinitingnan po natin na yung mga households po natin ay makakakuha ng mga services mula sa mga health facilities. Yes, next slide, please. Nag-move naman sa at saka yung ating mga frontline health workers, matutulungan din in terms of psychosocial services. Tapos, gusto rin natin na magkaroon ng massive dissemination sa bakuna messages, lalo na sa mga remote areas. At ang pang-apat po ay ang tulong sa vaccination drive para mas maparami pa ang mabakunahan dito sa BARMM region. So sa mga outcomes na to, we are aiming at 4 very simple but very direct activities. The first one is to develop a pool of volunteers to support the BARMM Regional Vaccination Operations Center para po mas mapa-expand pa yung ating vaccination sa iba't ibang population, lalo na yung mga special population natin, yung mga IP groups, at saka senior citizens. Pangalawa po ay, ngayon ay ang, lalo lang yun, it's a World Mental Health Month. Tama, no? Oo. So isa sa mga support na ating gagawin together with the ministry is to really provide mental well-being, psychosocial counseling support through our partner at Ateneo Bulatao Center doon sa ating mga frontline health workers dito sa BARMM. And then, previous slide please. Yung ating treatment, temporary treatment facilities or quarantine facilities ay bibigyan din ng suporta hindi sa mga monitoring facilities, lalo yung mga oximeter, oxygen concentrators, and oxygen tanks para mas mapabuti pa yung quarantine services doon sa ating mga COVID positive patients. And ang project din po ay in partnership with the Notre Dame University, Ocampo College, at saka ang JCI ay magkakaroon ng vaccination drive sa iba't ibang places, no? Okay. And nagmo-move yung slide ng sarili. Pasensya na po. So ang ating mga areas na tinitingnan ay ang Maguindanao Province at ang Lanao del Sur at of course dito sa Cotabato City. At meron na po tayo na-identify ng mga 5 priority treatment facilities kung saan doon ang pinakamaraming mga cases and patients. With this, we are hoping that the partnership will not just be for a short period of time, but also we will develop along with the needs, no, depending on the needs of the region towards building resilience against COVID-19. So that's it, and I'll turn it over to you, Errol. Thank you.
Okay. Maraming salamat, Ms. Chin, for that. At this juncture, we would like
Hello, everyone. Can you hear me?
yes, Ms. Karen.
Okay, great. Sorry, I didn't hear my cue to begin, so apologies. All right, good afternoon, everyone. My name is Karen James Ungar. I am the country representative for Catholic Relief Services, and I'm here today to represent Catholic Relief Services and share our message of commitment and express that we are honored to be part of this Memorandum of Understanding signing with the Ministry of Health. Our presence here today is symbolic of our commitment to support the efforts of the Ministry of Health to continue to face and overcome the challenges that COVID-19 has presented to communities across the Bangsamoro. So I'd like to extend our greetings to the guests, partners, and participants, Dr. Amirel Usman, Director General, Ministry of Health, and our thanks to Minister Dr. Bashari Latif for signing the Memorandum of Understanding and expressing the needs of MOH so that we can try to take on some of the burden facing Ministry of Health these days. Also, thank you, University of Philippines Mindanao, and any other partners that have joined us today. So we have been facing this pandemic for a year and a half now. It's put a big strain, not just on the communities and the economy, but also the healthcare workers. So I am really looking forward to this project. I think it's a unique opportunity to also support the mental health of frontline workers, and also to really maintain the efforts that so many actors are doing to overcome vaccine hesitancy in the BARMM. We really need to continue to work together, reach rural communities, Indigenous peoples, anyone who has had misinformation about the vaccine or is hesitant or afraid of it for a variety of reasons. So with these two things in mind, we're very pleased to be here today to sign a memorandum of understanding to work together to start our partnership. This is for 3 months, but we do hope it is the beginning of a longer partnership. CRS has been working in the BARMM, well, in Mindanao and in the former ARM area since the 90s. We have several projects, including peace building, social cohesion, and good governance. And we are in it for the long run to support the transition of the BARMM government. We also frequently respond to natural hazards and disasters that occur in across Mindanao and respond with shelter projects, wash projects, food, and cash, which we have been doing over the past several years. So we see this new partnership with Ministry of Health as a complementary programming to what we've been doing, and we really hope that we can leverage our presence in communities and with local partners to further the reach and messaging about vaccines for COVID-19. So through this memorandum of understanding, we do intend to work with Notre Dame University to have more volunteer nurses to assist in vaccine clinics, hopefully mobile vaccine clinics to reach the most rural communities. We do hope to provide more medical devices, medical supplies as they're needed. And then we do want to extend psychosocial support services to frontline health workers, which we will do in partnership with Ateneo. They've been doing our mental health services for our employees over the past year. And we're reaching out to other actors who have been working on health promotions, some of them funded by USAID for the health partners for COVID-19 in Mindanao, and we're going to be more sharing those messages and leveraging those messages and extrapolating those messages as needed via radio or whatever means. So that's our plan to start this. I do hope this is the beginning of a long partnership, and it is going to be founded on partnership, open communication, transparency. So please, we'll be working closely with you, and if other needs are identified, we can discuss them. If something's not working, we can discuss, but we do want aspire to have a very fruitful and productive partnership with this memorandum of understanding being signed today. So once again, thank you on behalf of CRS, and I do hope to be able to travel there in the next month or two and hopefully meet you in person. Thank you.
Yes, thank you, Ms. Karen. We would also like to have a response from Doc from the
Yes.
Ministry of Health.
Yes, Karen, thank you very much for this opportunity that, we actually, I know for a fact that since the 90s, the CRS had been very visible here since the ARM. And I'm also very thankful right now that the partnership is still ongoing. And I hope this will actually, in the many years to come, for a fact that the BARMM territory has been bombarded with both man-made and natural calamities. And now we have the biological calamity in the person of COVID. And you are here with us, extending assistance and help, especially to those special population, and especially to those people who are really in need of the touch of the government, and also from people like you. So I'm very thankful that you have provided us this opportunity, and I hope that I'm looking forward to a more fruitful and a very wonderful and good coordination with the CRS. So thank you very much.
Thank you, Doc. Thank you, Ms. Karen, for that very wonderful messages. Again, I would like to thank everyone for joining us this afternoon. I would like to mention the staff of the Ministry of Health, the team from the Ministry of Health. Also, we have also our partners from Dr. P. Ocampo College, also the UP Min Pahinungod. Thank you for joining us. Again, if any of our partners who are listening right now, if you are interested to be a part of this project, like having your medical frontliners to be with us, please do not hesitate to contact us. Thank you, UP Min Pahinungod. Thank you, Dr. P. Ocampo College. And if JCI also and Notre Dame are there, thank you, everyone. At this juncture, we would like to have actual signing of the Memorandum of Understanding from CRS and from Ministry of Health. So as of now, there's the actual signing from the Director General of the Ministry of Health and from the Catholic Relief Services. Marami pong salamat sa lahat. Virtual clap naman po sa atin. And before we end up, we would like to request physical photo. Chester, can you take the photos? Can you take the photos, Chester? And before that also, we would like to request our participants. Yes. It's done. Okay, thank you, Chester. And we would like to request also our participants, before we end up, to open your video. Chester, can you facilitate the taking of pictures to all our participants? Thank you, Sir Mike, Marsh, and to those our partners. Can you join us here, Miss Miss Ayla and Miss Saima, if you can on your camera. And okay, are we good, Chester?
Yes.
Okay, thank you. Ayan, meron pa one more time because may humahabol po from our volunteers. Ayan po. Ayan po.
Nakasmile pa rin ako.
Sige po. Ayan po. Sige. Maraming salamat po sa ating lahat. And please do not hesitate to contact me for the volunteering opportunity. Thank you, everyone. Maraming salamat.
Thank you.
Thank
Thank
you,
you
Sir
for inviting
Mike.
us.
Thank
Thank
you.
you.